Assalamualaikum and good morning to our beloved lecturers, Madam Ani Journey. We are from Group 1 and will presenting our program on Sustainable Development Goals, Health and Well-being under Mercy Malaysia. Now let's get to know our group members. These are our group members: Nur Marisa Balkis, me, Nur Ismailiana, next Siti Zaziratul Afiza, Nashatul Afrina, and the last one, Nur Batrisha.
Assalamualaikum, madam. My name is Marisa and I am my group's first presenter. First of all, sustainable development is defined as development that meets the demands and needs of the current generation without jeopardizing the demands and needs of the future generation, because resources are limited and must be sustained and preserved. Under sustainable development, it has 17 goals, whereby one of it, sustainable development goal number 3, good health and well-being, is the goal that my team will be reviewing. Beware though that this goal covers a wide variety of situations that may correlate with other sustainable development goals because it covers the scope of many types of health and well-being. With the overall goal of ensuring a healthy life, this goal was created to encourage the well-being of people of all ages and walks of life. Due to the fact that health is the foundation of mankind, any change in lifestyle will have a significant impact on health and well-being. SDG number 3 has its own unique sets of objectives, including establishing universal health coverage, which includes financial risk protection, access to high-quality essential medical services, and universal access to safe and effective essential medicines and vaccinations. After deciding on our SDG, we selected Mercy Malaysia as our preferred non-governmental organization to review their voluntary work, which is the Water, Sanitation, and Hygiene WASH program. But first, let's get to know what is Mercy Malaysia. First of all, Dr. Jamila founded Mercy Malaysia, or also known as the Malaysia Medical Relief Society. Its goal is to ensure that those suffering from calamities of any kind, such as natural disasters or a shortage of medical resources, will receive the proper assistance. And also, their mission is to provide long-term health-related development and risk reduction initiatives to the most vulnerable. So, in present days, Dr. Ahmad Faizal Muhammad Perdaus is currently the one who oversees Mercy as the organization's president, with 500 members in total and over 7,000 volunteers registered in their organization.
Everyone has the fundamental right to have access to clean water and sanitation facilities. Having access to clean water, sanitation facilities, and hygiene facilities is necessary in order to fully realize a community's potential for health and resilience. This issue of insufficient access to pure water has also brought about a devastating impact for all forms of life on Earth. For instance, children are particularly vulnerable to the health risks associated with contaminated water, sanitation, and hygiene, which is WASH. Therefore, Mercy Malaysia has introduced the Water, Sanitation, and Hygiene WASH program that could be a benefit for people in needs. This program was introduced under the strategic objectives, which is SO1, impactful humanitarian and development programs. To begin with, the objective mentioned is to align with the remains committed to Mercy Malaysia's vision of excelling in the provision of medical and humanitarian assistance to all those in need. In addition, Mercy Malaysia is a non-governmental organization (NGO) who is dedicated to the idea of building back better. As a result, throughout the phase of recovery and mitigation, Mercy Malaysia is typically involved in the rehabilitation and reconstruction of community buildings, including schools, community centers, and healthcare facilities. Therefore, this program was introduced and first held in Pulau Malawi, Kudat, Sabah, starting in January 2020, and the status of this project is still ongoing. Besides, Maybank Islamic Berhad is one of the many corporations that has been helpful towards funding Mercy with many of the programs that are beneficial to the nation and the country. Mercy Malaysia has collaborated with Maybank Islamic Berhad to ensure the smooth operation of this program. In addition, it is important to note that the majority of vulnerable communities, such as the B40 community, are served by this program. Ubian is the language spoken by the people who live on this island. The island normally has a dry season that lasts for at least 3 months out of the year. During this time, there is a shortage of water and the people there are required to buy drinking water for their houses. As a result, maintaining a clean and sustainable water supply as well as making certain that the atmosphere is well preserved and sanitary are ongoing concerns. By constructing a rainwater collection system and sanitation areas, this project intends to aid the communities in acquiring clean water and adequate sanitation practices. This will allow the islander to enjoy this fundamental human right and have a higher quality of life. The project's goal included the construction of sanitary buildings as well as the installation of centralized rainwater harvesting system. The fact that the village now has access to clean water means that family may have peace of mind knowing that the water they use in their homes for drinking and cooking is healthy and uncontaminated for their children and spouses. Even though the program is still ongoing, the output of this program still can be seen. Under this program, Mercy has focused on 3 zones for centralized rainwater harvesting for the community. It is important to know that rainwater harvesting can be an independent source of water in places where other water sources are not available, the water quality is not good enough, or they cost too much to develop, or they are hard to get. Next, because the B40 group does not have better access to proper sanitation facilities, which puts the health of the community as a whole and especially the health of young people at risk, resulting Mercy in working to develop 2 areas in the community that will serve as sanitation zones. However, as a result of the pandemic, the development of the outputs has been put on hold and it is intended to resume as soon as the situation allows it.
Mercy Malaysia also have done WASH program in Sarawak, which was held in Kampung Senah Rayang on August 2020 that's supposed to end in December 2020. However, due to the pandemic COVID-19 that requires the country to impose a movement control order, this program was ended on March 2021. Kampung Senah Rayang had been chosen because the life of the people there that utilize dirty water because there is no clean water supply. The situation, of course, very worrying because it will increase the incidence of water and sanitation-related disease such as cholera, diarrhea, hepatitis A, typhoid, and polio. So how we can achieve the sustainable goals of good health and well-being if the people in our country itself still live with a vulnerable condition where they just think about basic necessities for them to continue their life? For us, maybe we need clean water so that our health is taken care of. But for them, it is enough if there is water so that they can do their daily activities without thinking the bad thing that will happen for their future if the water is dirty. They have no choice. That is why one of the Mercy Malaysia objectives in this program in Sarawak is to take a proactive action to construct clean water distribution networks with pipe system. This is done to make sure that the clean water from the Bengoh Dam in Kuching can get to Kampung Senah Rayang where the residents can use it for everyday use without worrying about getting sick because the pure water has already been treated before it is supplied. Therefore, if the water is already clean and high sanitation, there is no water-related disease can happen. Second objective that Mercy Malaysia wants to do in Kampung Senah Rayang is to provide the community-based disaster risk management training on water system management for local communities. It also aims to raise awareness of the value of water, sanitation and hygiene for health. In this program, Mercy Malaysia works to train the communities that reside in Kampung Senah Rayang on how to handle the water system if the same issue reoccurs and pollute the water supply. People can therefore find a solution at least temporarily while they are waiting for assistance from the authorities. Mercy Malaysia may also encourage excellent health and well-being by raising community awareness of the importance of clean water, proper sanitation and good hygiene. This is due to the Mercy Malaysia not having enough time as they have a lot of programs, so it is up for them to consistently visit that location and check on the health of the community there. Instead, Mercy Malaysia raised the awareness so that the community members are aware of what they need to do for their health. Community-based disaster risk management, however, are still prohibited by the COVID-19 pandemic and MCO because doing so would disrupt the government's effort to stop the spread of COVID-19 cases if there were a program that involved many people in one place. As a result, this program closed with one activity that has already been successfully implemented, which is to construct clean water distribution network with pipe system. The other are still ongoing and will take some time for Mercy Malaysia to restart because they involve the communities. Thank you, Nasha, for your great explanation on your part. And now, without further ado, I will continue with my part on the benefits of the program to sustainable development. So, our group has chosen a program by Mercy Malaysia known as Water, Sanitation and Hygiene, or it can be called as WASH program. This WASH program by Mercy Malaysia does bring a lot of benefits to the communities as a whole, since it can be related with the sustainable development goals, especially the third one known as good health and well-being. So the first benefit of this WASH program is in terms of good health and well-being. Good health and well-being are essential for ensuring healthy lives and promoting well-being at all ages. This WASH program by Mercy Malaysia is beneficial since they try to prevent those residents at the affected areas in Sabah and Sarawak from contracting and infectious diseases by providing them a clean water supply. A clean water supply not only promotes the essentials of health but also supports the livelihoods and builds resilient communities with a healthy environment and surroundings. If they have been provided with a clean water supply, a good sanitation and hygiene by Mercy Malaysia, it can make them to have a less chances of being infected with the infectious diseases, and they can have good health and well-being. If they have a good health and well-being, they can do their daily routine and work like usual. Therefore, it is accurate to say that this WASH program is beneficial since it could lead to a sustainable development goal number 3 that is known as good health and well-being. The second benefit from this WASH program that can relate to a good health and well-being is it can decrease risk of diseases. As we know, clean water is a necessary component of the world that we are currently living in. However, each year, millions of people, especially children, lose their lives to diseases that are linked to contaminated water such as hepatitis A, typhoid, and others due to the bad economies or inadequate infrastructure. Thus, Mercy Malaysia tries to provide clean and pure water to the affected residents by implementing this WASH program. This is to ensure the residents can use the clean water supply for their daily needs and they no longer have to worry about getting sick since the water has been treated before it is being used. Apart from that, the existence of clean water to the residents can decrease the risk of diseases, especially the infectious ones. Thus, this WASH program can lead to a good health and well-being, since clean water can contribute to a healthy brain and body function, growth, and development. The last benefit of this WASH program that can relate to a good health and well-being is it can save the cost of treatment. As it has been mentioned, there is water pollution in certain areas of Sabah and Sarawak, and contaminated water can lead to any kind of serious diseases. The accessible water in certain areas of Sabah and Sarawak, especially the rural ones, has been polluted, making the residents to be prone to infectious diseases. Hence, this WASH program by Mercy Malaysia is really advantageous since they have tried several ways to get a clean water supply to the residents there, and those residents can protect themselves from getting a contact with a variety of diseases, and they can save their cost of treatments as well. Therefore, it is accurate to say that a good health and well-being is really important because it can save someone from receiving a frequent medical treatments, and they can save their cost of living by not spending so much money on medical treatments only. All in all, it can be concluded that water is essential for everyone in the world, and clean water can ensure someone to have a good health and well-being. So that is all from me, and now I will pass the next part to the next presenter.
Thank you, Batisha, for the explanation. Now we move on to the suggestion for improvement of the program. There are 4 collaborations to improve water sanitation and hygiene program. The first collaboration with Jabatan Air Negeri Sabah. This collaboration will able to further empower Mercy Malaysia effort to ensure the program run effectively, as Jabatan Air Negeri Sabah can give secure of supplies of clean water for the people of Pulau Malawi Kudat Sabah, so that this will avoid disease and make cure and will be ensure health and well-being of the people having a clean water. Next, collaboration with Sarawak Rural Water Supply Department. This will ensure the continuation of program by carrying out the repair and restoration of the water pipe system continuously, so that the supply of clean water resource can be provided to the resident Kampung Senah Rayang, Sarawak. The third is the Malaysia also can expand the WASH program to rural area in Peninsular Malaysia. This will achieve the Sustainable Development Goals in terms of health and well-being in the whole state of Malaysia, with the collaboration the Global Peace Foundation Malaysia that have provided initiative to improve access to clean water, so that there's no disease outbreak will affect among the community. Last but not least, improvement of clean water of the program Water Sanitation Hygiene Program, where Malaysia can collaborate with International Federation of Red Cross and Red Crescent Society, which has same goals in the development of sustainable health and well-being. This will ensure people across the country have equitable, sustainable and affordable access to water and sanitation service, so that water sanitation and hygiene program can give incentive be sustainable for the long term for the community. That's all from me. I will pass to the next presenter, Marisa, to talk about the conclusion.
In conclusion, excellent health and well-being are essential for people because certain areas do not have access to such amenities due to different amounts of resources. That is why it is essential to preserve this because they are essential in the life of today's population. Many people will suffer from different illness if it is not present. As a result, Mercy Malaysia made a wise decision to establish the WASH program. In addition, it also is in line with the third Sustainable Development Goal, where they want to promote better lifestyle and well-being. So, in restoration and preservation of water supply, it has helped the people in their area access healthy lifestyle as they now have access to clean water, which will avoid illness such as hepatitis A and many more. Hence, this is all from us. Thank you for lending your ears for us.